We appreciate you being here for our June Lunch and Learn. We will go ahead and kick it off. Just a few um, ground rules for Lunch and Learns if you haven't attended one of Resilient Georgia's Lunch and Learns before. Not even ground rules, just housekeeping. Is that we record these presentations. So afterwards, we will send out a follow-up email with all the resources we discussed, the recording from today, and the presentation from the Lunch and Learn. After the presentation, we leave about 10-ish minutes for a Q&A. So have your questions ready. You can put them in the chat. We can address them in real time or during that 10-minute Q&A. But with that said, I'm excited to introduce our presenter today. So as the theme of our Lunch and Learns for 2026 have really come from an evaluation survey we did last year for our coalition leaders and asking what were different initiatives or models that you were interested in learning more about. And a lot of folks said that they were interested in understanding mental health parity and its implications for their work and the work of their partners. And so we're so excited that Sarah Phillips is here today to help give us that overview and maybe answer some questions that everyone has. And Sarah is the Associate Director of the Rosalind Carter Mental Health and Caregiver Program at the Carter Center. And Sarah, I'm going to hand it over to you.
Great. Thank you so much, Alex. And hello, everyone. It's an honor to join you today. I am truly thrilled that this group identified parity as a topic that they wanted to learn more about. It really takes a dedicated group to get together and want to talk about health insurance. So thank you for that. And thank you for letting me join your space today. As Alex said, I'm Sarah Phillips. I am the Associate Director for the Carter Center's Rosalind Carter Mental Health and Caregiver Program. And if you wouldn't mind, Alex, advancing to the next slide, I'll just start by giving a brief overview of our program. So the Carter Center, of course, was founded in 1982 by former President Jimmy Carter and former First Lady Rosalind Carter, but building on her more than 5 decades of advocacy around mental health and reducing stigma and improving access to care. She founded the mental health program underneath the Carter Center in 1991. Simultaneously, she also stood up and ran the Rosalind Carter Institute for Caregivers, which at that time was affiliated with the Georgia Southwestern University, which is her alma mater. But it was always Mrs. Carter's vision to bring these two issues together. She acknowledged throughout her many years of advocacy that it's difficult to talk about mental health without also addressing caregiving and caregiver burden and the well-being of caregivers themselves, and vice versa. It's hard to talk about caregiving without also addressing mental health. So this vision of the intersectionality between mental health and caregiving became a reality this past summer of 2025 when we formally merged and became the Rosalind Carter Mental Health and Caregiver Program underneath the Carter Center. So when we talk about parity, we often talk about it in terms of not only the mental health implications, but also the implications for families and caregivers of those who might be experiencing a mental health crisis or who are in need of care. So our vision as a program is a world where mental health and caregiving are valued, promoted, and protected, and all people can access the inclusive care they need to live with dignity and well-being. And at the Carter Center, we have the real privilege of working with Resilient Georgia in a number of capacities, and have also gotten to know many of the coalition members through our work with youth mental health and parity and employer engagement. So again, really great to be here. Next slide, please. So mental health parity, what it is and why it matters. So some of you may already kind of get the gist, but I never like to assume that we're all starting with the same level of knowledge. So just to kind of do some table setting here, at its core, mental health parity means that mental health and substance use disorder care must be covered by insurance at the same level as physical health care. So, in other words, if your insurance covers treatment for any physical health condition, diabetes, cancer, asthma, whatever it may be, it must also cover treatment for depression, anxiety, substance use disorder, other behavioral health needs in a comparable way. So, what's important to note is that parity applies really across the entire structure of an insurance benefit. So, this includes financial requirements, like the kind of copay that one might pay, your deductible with your insurance plan, your out-of-pocket maximums. But it also includes things like treatment limitations, how many visits you're allowed to have per year, how long a treatment can last, or whether you're required to get permission before care begins, like prior authorization. Um, Importantly, it can also include things that are less visible to consumers, but every bit as important. So, utilization review and how insurers decide whether care is deemed as medically necessary. Um, when parity isn't enforced, what we see in real life is families being pushed out of their network, forced to pay out of pocket, go out of network to seek care, or told that their provider recommending care isn't medically necessary, with little or no explanation for that determination. Um, Through our work at the Carter Center and through the work that many of you all do, I'm sure you also hear just how confusing and overwhelming this is, especially when people are already in crisis, trying to get help for a child, for a family member, for someone that they're providing care for, or themselves. Um, Many people often don't realize that these practices of denying coverage for mental health care may be illegal. They don't realize that they have rights under federal and state parity laws, or that they're entitled to an explanation, an appeal process, or an external review. And this lack of awareness becomes another barrier layered on top of already unequal treatment between mental health and physical health care. So that's why enforcement of mental health parity really matters. And we're going to spend some time on what enforcement looks like and means today, because that's kind of the stage that we're in with parity in Georgia. Because we have a parity law, we'll get into that, but without strong implementation and oversight, parity laws risk kind of becoming obsolete, frankly, something that exists in paper but doesn't actually manifest in real life or in practice for individuals and families. So, strong parity enforcement and continued prioritization just ensures that mental health care is treated as real health care and not differently from other types of care. Next slide, please. So the modern parity framework really begins at the federal level. So we have the Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act, which is a bit of a mouthful. So you'll often hear people refer to it as MAPIA. MAPIA was signed into law by George W. Bush in 2008. This federal law established that behavioral health conditions should be covered by insurance equitably, or in other words, at parity with other illnesses. This was a bipartisan effort with a great deal of support. And while there have been other federal parity measures, this is kind of known to be the landmark parity legislation at the national level. A couple years later, the Affordable Care Act's essential health benefits expanded the number of plans that must offer behavioral health coverage and therefore must also comply with parity laws. So, over time, federal parity law has evolved from addressing simple quantitative limits, like, for example, visit caps, to regulating things like non-quantitative treatment limitations, or NQTLs. So those are the things that, like I said before, are a little more difficult to catch when these violations are occurring. These include things like prior authorization requirements, or step therapy, which is when your insurer requires you to try a cheaper or different method of treatment before they will cover the one that your provider has recommended for you, and just other reimbursement methodologies. So all of this is really important that we have this at the federal level, but the challenge is that even federal parity law relies heavily on state level enforcement. Federal agencies can set the standards and issue the guidance, but insurance regulation is largely a state function, especially for fully insured plans and Medicaid managed care. So even with strong federal law, enforcement really is contingent upon what is happening at the state level, which brings us to our next slide on Georgia. So in 2022, Georgia passed House Bill 1013, the Georgia Mental Health Parity Act. This was widely recognized as one of the most consequential behavioral health bills in the state, really in recent memory. So, a little bit about what the law does. It applies parity requirements to state regulated private insurance and Medicaid care management organizations. So essentially, it gives some teeth to what has already been mandated at the federal level, but in a way that the states can actually implement and enforce. It assigns enforcement authority to the Department of Insurance and the Department of Community Health. So the Department of Insurance is our state regulator who oversees all private insurance plans, like your employer sponsored. And then our Department of Community Health is responsible for overseeing public insurance. So things like Medicaid managed care, the state health benefit plan for state employees, Peach Care for Kids, which is Georgia's CHIP program. This law funded a dedicated parity enforcement position underneath the Department of Insurance. It has improved parity complaint pathways. Now we're required to have a parity consumer complaints portal on both the Department of Insurance and Department of Community Health websites. And it requires greater transparency around parity compliance data. So insurers are required to submit their parity compliance data annually, and the regulators look at that data for potential violations and subsequently make this data publicly available, though it is quite complicated data. So we'll get into some of that in terms of transparency a little later. So again, all of this is greatly important, but what we know very clearly from different types of mental health advocacy and advocating for health access is that this law created opportunity, but not certainty that it would do exactly what it was intended to do. No amount of statutory language can by itself necessarily educate consumers about their rights, guarantee that insurers are going to comply with the law, or even ensure that agencies have the sufficient capacity to enforce what is an extremely complex insurance law. So that work still had to happen, and that is the work that is underway. So I'll talk about that a bit more in this next slide. The challenge of implementation, like I said, passing a law is a really critical milestone, but it is the first domino to fall in a long row of many dominoes. A law on the books does not automatically change how insurance companies operate, how providers are reimbursed, or how families experience accessing the healthcare system. So what determines whether parity actually improves access to care is implementation. Implementation, the way that I think about it, really requires three things working together. And those three things are awareness, accountability, and infrastructure. So awareness means that consumers, providers, and employers actually know their rights and responsibilities under the law. This lack of awareness can show up everywhere. The families might not realize that higher copays for therapy constitute a potential parity violation. Providers may assume that denials are routine rather than something that they can challenge. Employers, who are a key partner in this work, and we'll talk about that today, they play a major role as purchasers of insurance for their employees, may not know that parity obligations apply to the plans that they sponsor. So without clear, accessible information and education, parity exists kind of silently in statute while people continue to experience this discrimination in practice. Now, accountability means insurers and state agencies are held responsible for applying with or complying with parity, requiring insurers to submit annual reports on parity compliance, which allows regulators to track those compliance gaps and identify these continued pervasive issues, is one way in which this happens, like I spoke to on the last slide. That enables the Department of Insurance or the Department of Community Health to conduct targeted investigations, also known as targeted market conduct exams, when insurers are found to be in violation. And then once these violations are uncovered, levying substantial fines for those violations, and then coming up with corrective action plans with the insurance providers to essentially mitigate the risk of this happening again in the future. So we'll talk a bit about some recent activity that's happened in that space. And infrastructure means the state has the systems, the staffing, and the processes in place to monitor and enforce compliance. Like I said, we have a dedicated parity officer, but we also need sufficient staff in federal and state agencies to conduct these reviews. We need user-friendly, culturally competent, parity-compliant portals for consumers to use when they suspect they've experienced a parity violation. So without all three of these pieces, the awareness, the accountability, the infrastructure, parity laws can stall, and we've seen this happen in other states across the country. Georgia's not unique in facing these challenges. The difference is that Georgia's 2022 law created a foundation that makes real progress possible and attainable. But again, this progress is not automatic. Other states have passed really strong parity laws only to see limited impact because implementation was under-resourced or fragmented, or perhaps it was politically deprioritized. So the work that we're doing at the Carter Center with the Georgia Parity Collaborative, it was really focused on helping to close these gaps so the law leads to real world improvements in access to care versus simply good intentions for the law. And again, that's why I'm so grateful that there was interest among this group, because there are ample opportunities to make this a reality. Next slide, please. So I want to talk a bit about the way that we kind of view our approach to ensuring holistic parity implementation in Georgia, because depending on the type of work that you do, the type of communities that you serve, and who you interact with on a regular basis, there may be different places throughout this process that are most appropriate for you to plug in. So I lovingly call this our grassroots to grass tops approach. Which recognizes that parity implementation and enforcement does not happen in a single venue. It really spans the gamut, all the way from understanding the lived experience of people on the ground in the communities and translating that up to our state decision makers, and then bringing back that information to the communities. It's really a cyclical process. So I'm actually going to start on the bottom right there, gathering stories from people with lived experience. What we found quite a bit of when House Bill 1013, the Georgia Mental Health Parity Act, was in its infancy, was that people weren't submitting violations because parity was new. They didn't know that it was a right to have that coverage. And so our state regulators might have said, well, parity compliance is going great in the state. We haven't received a single complaint. But what we know from talking to people on the ground and having relationships with provider groups who are often running into these barriers with their clients and their patients is that people were still experiencing barriers to care even after the passage of House Bill 1013. So it's really important to collect these stories so we can say, actually, no, we know that these things are still happening. Here are however many examples of how this is manifested. And we take these stories, we educate media and legislators about the issue and ensure that these stories are not falling by the wayside simply because, again, the law passed and we've moved on to the next thing. These are still things that require serious prioritization. It's critical that we continue to offer support to state agencies as they're carrying out their implementation duties as prescribed in House Bill 1013. House Bill 1013 is a 76-page omnibus bill that tells a lot of different people to do a lot of different things. So there's a lot of opportunity to offer that technical assistance and support. But just to give you all an example of one way that that we did this, I know I mentioned that one of the requirements of the bill was that departments have a consumer complaints portal so that folks, if they suspect they've experienced a violation, can submit a complaint. But what we found was this parity violations portal was extremely difficult to navigate. So we partnered with some other organizations, including a disability rights group who really was well versed in working with different levels of accessibility. And we put together a set of recommendations that also included things like survey logic and standardized data collection so that the Department of Insurance is as well equipped as possible to really parse out those violations when they come through, and then they're not getting filed as the wrong type of insurance, or maybe it's unclear that it is a parity violation. So that's an example of the type of support that can be offered that really serves the communities that you work with, but also ensures that the state is equipped to do the same. Providing testimony and best practice research. This is huge as we continue to evolve in our state of behavioral health access. We continue to advocate before the Behavioral Health Reform and Innovation Commission here in Georgia. We talk about what other states are doing really well, where they've moved the needle and ensuring that insurers are complying, that people know their rights. So this is critical to continue and uplift the importance of this issue. Now, over on the other side, it's this is where, and I know I don't need to say this to this group because you're here, you're in a coalition, you clearly understand the importance of coalitions, but recognizing and leveraging the overlap in coalition focus areas is huge. You don't necessarily have to start a coalition focused on parity, but knowing that perhaps your coalition on youth mental health might have an interest in parity because of how it impacts youth and families. Finding those intersection points and bringing what you've learned from your conversations with legislators, with state agencies, with other advocates, with other employers, bringing that to these coalitions is really important. And continuing to uplift these issues. Again, this is something that we've continued to do long past the passage of the bill. We, as the Carter Center, continue to host advocacy days at the Capitol each year focused on parity. And we organize the Georgia Parity Collaborative, which I'll speak more about momentarily. And through the Parity Collaborative, we also work very closely with our partners to design and implement and disseminate a parity awareness campaign, ensuring that consumers know their rights and understand that they can file an appeal and submit a complaint if they have experienced a parity violation. So the critical insight from this slide is just that each component strengthens the other. Public education leads to complaints. Complaints justify agency action and enforcement. Agency action reinforces public trust. Coalition pressure keeps enforcement on the agenda. It really is the critical cycle. Next slide. So one of the most important tools that we have for parity enforcement is coalition building. The Carter Center convenes and chairs the Georgia Parity Collaborative, which includes more than 70 now statewide and national organizations. Our coalition brings together advocates, providers, legal experts, business leaders, and people with lived experience to create and coordinate just that consistent pressure for strong implementation of the parity law. In our coalition, we have representation from the disability community, we have peer-led organizations, caregiver and family organizations, consumer protection organizations, and many, many others, some of them being our unlikely suspects. Um, because individually, our organizations might only have so much influence, but collectively, we're able to elevate parity as a policymaker priority and serve as a trusted resource for legislators, the media, and state agencies. The collaborative also plays a critical monitoring role as we're still kind of in this first few years of the law's implementation. So together with all of our partners, we're tracking implementation, we're identifying gaps, keeping parity visible through things like our annual mental health parity day at the Capitol and our monthly open to all meetings. And for it's been really useful to us at the Carter Center because we're not a direct service provider ourselves. But a key strength of the collaborative is that it includes provider and consumer facing organizations, which allows us to integrate these perspectives into our policy recommendations and other communications that we have with our state agency leaders and our legislators. Slide. So again, one of the most important lessons from Georgia is that public awareness is not optional when it comes to parity implementation and enforcement. Parity laws rely heavily on consumer complaints, but people can't report violations that they don't recognize. So that's why we've developed now two multimedia public awareness campaigns to raise awareness among underserved Georgians about their rights to mental health coverage under parity laws. So here you'll see two examples of the creatives that we have developed. On the left, this was the campaign that we ran in 2023. This campaign ran in Savannah and Albany simultaneously, and it was kind of more of a know your rights campaign. We did a lot of key informant interviews and focus groups to come up with the messaging and figure out how do we talk about parity without saying the word parity? How do we make it so that it's understandable and recognizable to people who have health insurance and who may have received a denial but not necessarily known that it's a parity violation? And where do they go from here? So I sometimes like to describe the graphic on the left as being similar to one of those kind of buckle up, it's the law billboards that we've seen for years on the interstate. And again, that ran in Savannah and Albany in 2023. But we knew that we wanted to continue running these campaigns and adapting them for various communities, which is why in 2025, we actually came up with the graphic on the right. So this one ran in Metro Atlanta. And again, a lot of key informant interviews and focus groups and working with partners who serve our target demographics. Really fed into the creation of this graphic, which is your body and mind equally important, now equally covered. Now, both of these campaigns have led back to our campaign website, georgiamentalhealth.com, which talks about what a parity violation looks like in reality, how a lot of people experience it, but also what to do if you, and thank you, Annalisa, for dropping that into the chat. There's a link there. What to do if you've experienced a parity violation. You have private insurance from your employer. Here's where you go. You have maybe Medicaid managed care. Here's where you go. We really just want to make the process of identifying a parity violation and submitting an appeal or submitting a complaint with the state as simple as possible. And actually, keep your eyes peeled if you're in Metro Atlanta because we are currently running the campaign again in Metro Atlanta in kind of concurrence with the FIFA World Cup while folks are out and about in the city a lot. Next slide. So, this may be familiar news to some of you, but in 2025, the state issued its first enforcement action under the Georgia Mental Health Parity Act. The Department of Insurance announced roughly $25 million in fines against insurers found to be violating parity requirements. So, this was huge. This was a significant step for Georgia, moving parity really from policy to real enforcement. And it's part of a broader national shift toward treating parity violations as a serious compliance issue versus just a consumer frustration, right? Um, but at the same time, it's important to be clear about where things stand right now. The appeals processes are still ongoing. So the companies have not yet paid these fines. But once this does happen, the next phase is the department will need to establish and monitor corrective action plans with insurers to address the underlying practices and prevent repeat violations. Um, so for advocates, much of this process is tricky and remains hard to assess in real time because key details are not public at this stage of the process, in part due to the Trade Secrets Protection Act. So this makes ongoing monitoring and sustained engagement even more important. Um, but still, I don't want to undermine the win here and also acknowledge this didn't happen overnight. It was the result of sustained advocacy, consistent public education, strong coalitions, lots of really dedicated mental health advocates across the state, and ongoing monitoring. Um, I think it really demonstrates that enforcement action shows that parity laws can have teeth and can really result in some serious action, but only if there is vigilance and follow through. Next slide. So this is all extremely important and a major step in the right direction for mental health access. But when we think about these oftentimes multi-billion-dollar insurers, fines alone can be a drop in the bucket. I mean, think about that 25 million we just talked about. 25 million spread across 22 insurers might not be a lot of money for them. It might be as simple as the cost of doing business or considered cheaper to just pay those fines and move on than it is to provide the coverage that they're mandated to provide in the first place. So for this reason, we also have to think about other mechanisms for accountability. And real leverage oftentimes comes from their largest clients, employers and businesses who can demand better plan design and parity compliance, and whom we're engaging through some of our parity work right now. When equipped with the right tools and knowledge, employers can really take on an active role in holding insurers and third-party administrators accountable by ensuring their providers' compliance with parity laws. Next slide. So it's for this reason that we've developed a year-long cohort and roundtable series. Working with the same employers over time allows them to build knowledge, trust, and momentum, and move from awareness to action. And actually, we have several Resilient Georgia Coalition members in this cohort. So we're really, really grateful that, again, this is a group that's taken this on as a priority. But essentially, we start with Parity 101, grounding employers and what the law requires and how their purchasing power shapes coverage. From there, we move into practical tools for reviewing plans, asking the right questions of brokers and TPAs, and identifying those gaps in access. We had our first roundtable a couple of months ago. We're about to have our second roundtable, but during that first roundtable, we saw quite a few aha moments. In particular, many participants were surprised to learn how much responsibility employers do carry for parity compliance. But by the end of the session, they left feeling more confident and with practical tools they could take back to their workplaces. And then the final session of the year will really lean into leadership and positioning employers not just as plan purchasers, but as advocates who can influence insurers, regulators, and policymakers. So we're pairing this with employer-focused toolkits and return on investment resources that connect Parity to productivity and retention and workforce well-being. You can see a screenshot of our soon-to-be released employer toolkit that I'll be sure to share with Alex and others to share with this group once it's officially live. We're expecting that within the next month or so. Um, but again, the goal of all of this is to help employers move from just being purchasers to being active partners in parity enforcement and strengthening accountability while also improving access to care for Georgia's workforce. So, our experience with parity in Georgia has reinforced several key lessons. First is that public education drives consumer reporting, and consumer reporting is essential for enforcement. Second, coalitions again amplify influence in ways that no single organization can. Third is that legislative wins require follow through. Without that continued attention and prioritization, momentum risks fading. And finally, policymakers are far more responsive when data, lived experience, and aligned partners come together. These lessons have really shaped how we think about parity, not just here in Georgia, but across the country. So with all of that, I would love to invite everyone here to our event that we're having at the Carter Center on August 20th. It's Coverage and Culture Employer Symposium on Workplace Mental Health. We'll talk a lot about some of the things that we discussed today, how employers can be active accountability partners in mental health parity, but also talk about creating a culture of workplace mental health. And one final thing I'll touch on here, my good friend Whitney Griggs from Georgians for a Healthy Future originally was supposed to join us today, but she had a family commitment. So I promised her that I would give a sneak peek to everyone on this incredible, incredible resource that Georgians for a Healthy Future has put together. It is a mental health parity dashboard, if you wouldn't mind advancing to the next slide. This is a free tool developed by Georgians for a Healthy Future that tracks how well Georgia enforces mental health parity laws. So I talked about how that data that is put out by the departments can be really difficult to demystify. It's wonky, it's confusing. You don't get any more user-friendly than what Georgians for a Healthy Future has put together. They created what is essentially a red light, yellow light, green light system and goes into all of the insurance providers in Georgia, both public and private, and how they're doing with their parity compliance. So the link is on the next slide. mhparity.healthyfuturegA.org. Oh, she got it. Amazing. Yes, incredible resource and highly recommend everyone checks it out. And I'm so sorry to only leave 7 minutes for questions, but I'm so grateful to get to talk to you all. And thank you so much for your attention and your willingness to get together and talk about mental health parity today. I'm happy to take any questions you might have.
Thank you so much, Sarah. We appreciate all of that information. It really is so informative and helps me even understand mental health parity a little bit better. So thank you for sharing. Yeah, we have a few minutes left for Q&A. If anyone or if Annalise, if there have been any questions in the chat we need to get back to.
No questions in the chat yet.
Okay.
I have one. Sarah, it's Emily. Good to see you.
Hey, Lillian.
Would you mind sharing a little bit? I think it would be helpful for folks to hear how you briefly mentioned it, but I'd love for you to share more how our different groups have also helped to educate state agencies. I think that's been a super important piece. I think folks can understand putting pressure on this, on the insurers, but I love the working and kind of educational relationship that has been created over the last few years with state agencies.
Absolutely. Yeah. Thank you for raising that. And I think Emily Ann and Resilient Georgia are some of the best role models when it comes to having those incredible working relationships with our state agencies. So really where we're at with parity right now is that kind of the cards are held by our departments who are implementing these laws. And so it's really important that we have this open, kind of bidirectional line of communication with them so that they not only are willing to take our calls, frankly, when we see a gap or a disparity, but also so that if they notice an issue on their end, they feel at liberty to reach out to us as advocates, as the Carter Center, as Resilient Georgia, as anybody else who might maintain that open line of communication. Um, and get support when they need it because frankly these are departments who are being asked to do a lot with already quite limited bandwidth. So I think really where we come at it from is balancing that level of accountability with also being a supportive partner. So rather than reaching out to them only when we see an issue, of maybe we've heard that there's a particular insurer who is a repeat offender, a frequent flyer of parity violations, rather than simply reaching out with a problem or simply reaching out about your consumer complaints portal isn't user friendly. Rather, we highlight why this is an issue, but we also couple it with solutions that we've put a lot of thought and collaboration into formulating. So we, like I said, have worked with other groups to develop recommendations. We oftentimes look at other states who are further along into their parity implementation process and say, here's what's worked really well in other states that could feasibly be adapted here in Georgia. Or maybe it's just a piece that we can draw from Illinois and a piece that we can draw from Arizona. And how do we put that together to make a solution that is right sized for Georgia? But also letting them know that we're watching too. Like I said, ensuring that there is that level of accountability. We, especially in the first year of the bill's implementation in 2023 and 2024, we knew when certain data calls were due for the first time. We, based on what was prescribed in the legislation, or we knew when to expect certain reports that were going to be published on the department websites. So we would proactively reach out and acknowledge and thank them for their carrying out what the bill prescribes, but also letting them know that we're keeping an eye out. We're working with our partners through the Georgia Parity Collaborative, through other groups, working with Resilient Georgia, and we're standing ready to be supportive partners if need be.
I have a question and also a comment. There was a QR code that was a part of your presentation. I think it was an upcoming conference.
Yeah.
So I wondered if you might be able to put that back up. And my question is for the local coalitions. What would you say our task, our role should be in helping to support this? Is it just to let folks know about the parity law and how to be able to report if in fact they are denied? What's the primary role for us?
Yeah, no, that's a great question. And I think it can take a couple of different forms depending on where you feel most equipped to plug in. Certainly, that consumer awareness and letting people know that they have the right to coverage is critical. And actually, this just came to mind for me. So I'm gonna share this with Alex, and hopefully she'll be willing to share it out with you all. Is we do have a partner toolkit that was created in concurrence with our parity awareness campaign that has some example messaging and templates of how you can share things on your social media or via email, or maybe it's more person to person than that, but some recommended mechanisms of sharing more about your rights to parity. So that is certainly huge. I also know that there are a lot of businesses and employers among the local coalitions, and like I said, because that is such a lever for accountability, we're really trying to build this kind of wave of employers who are recognizing their power as purchasers of health insurance and educating them on the questions that they can be asking their insurers about their parity compliance. So, I'm glad you asked about bringing this event back up because this will be fully open to the public. Would love for you all to share if you know of anyone who might be interested in attending. Um, and then the last thing I'll say is continued storytelling. I mean, you all are working so closely with your communities and individuals and constituencies. So really just if you hear of something that smells like parity violation, capture that. Think about like how that story can and should be told. And the Carter Center, and I know Georgians for a Healthy Future too, are always looking for these stories, which can be quite difficult to come by, as I'm sure you can imagine, because not everyone knows that a parity violation is a parity violation. But if you're ever coming across those and able to share that with us, then we can help capture that and turn that into a real kind of lever for advocacy.
Thank you for that. I'd love to see the toolkit and see how we might be able to help support that in here in Gwinnett County.
So thank you so much.
Yes, thank you for that, Shannon. And I'll make sure to pull out that flyer too from the presentation. So whenever in the follow-up document, everybody has, access to that. But I put the link in the chat too. Oh, and Annalisa did it. Thank you. We were both thinking the same thing. Well, if anyone has any one or two questions, or Sarah, do you have a minute? If anyone has anything that they'd like to stay on for, I know we're over time. And if you have to hop off, totally fine. Um, but yeah, thank you all for being here, and I hope you have a wonderful rest of your week. Sarah, we're so appreciative of this presentation, and it gives us all a lot to think about how we can continue to uplift and create awareness on the regional level across the state. So thank you so much.
Thank you all so much. And I just dropped my email in the chat. Feel free to reach out anytime with any questions.
Perfect. Thank you all.
Have a good one.